Pregnancies can be high risk for lots of different reasons. When a pregnancy is considered high risk, that essentially just means there are additional things that we'd be watching for or monitoring mom or baby for outside of what's considered routine prenatal care, whether that's extra ultrasounds or extra surveillance of how baby is doing. Sometimes it's extra lab tests or other testing for mom, but it essentially just means anything that's outside of routine where we want to take extra care of mom and baby to give them the best possible outcome. There are lots of reasons that patients get referred to maternal fetal medicine. Some of those reasons are maternal or health conditions for the mom. Those most commonly would be things like high blood pressure, or diabetes. Sometimes there are other medical conditions like lupus or medications that moms might need to take. The other side of that would be conditions with the fetus or the baby. So whether that's twin or triplet pregnancies, sometimes there can be changes in the growth of baby or changes in the way babies are developing if there are certain birth defects or other conditions that we're monitoring for. When patients are followed by a high-risk pregnancy specialist, sometimes we can lower the risk by using certain medications to control, for example, blood pressures or blood sugars. Sometimes things change and baby's growth may improve. And so it is possible to lower the risk, but many times once patients are monitored with a high-risk pregnancy specialist, they're continued to be monitored throughout the pregnancy. It's just the frequency of visits may change. Once you have a condition that is high risk in pregnancy, you will still receive all of the routine prenatal care, screening for things like diabetes, screening for blood pressures, monitoring how your belly and baby are growing. All of the routine care will stay the same. But we frequently will do additional visits for ultrasound monitoring, sometimes extra lab visits, sometimes extra visits with other medical specialists, cardiologists or heart doctors, pulmonologists or lung doctors, depending on what the mom's condition is or depending on what the baby's condition is. We might also refer you to pediatric specialists if we anticipate your baby may need extra care after delivery. So you may also meet somebody like a pediatric cardiologist or a pediatric kidney specialist or people like that. Even if your pregnancy is high risk, many times labor and delivery management can be similar to what you would otherwise typically expect. Depending on the condition, we may recommend more monitoring in labor, which can still be done with portable monitors or waterproof monitors, so moms can absolutely still labor in the tub, even if we're inducing your labor or doing other things. There are certain conditions that would increase the risk of a C-section. Things like babies that are expected to be very big because of diabetes or certain birth defects. If we're anticipating a baby may not tolerate labor or a vaginal delivery, we may recommend changes to the birth plan, but those are really individualized. And many times we can make a birth plan still be very individualized and personalized, even if there are some high-risk concerns for mom or baby, to do that as safely as possible. If you have any concerns that you may have a high-risk pregnancy, this is something I'd encourage you to speak with your doctor or care team about. But I like to remind all of my patients and moms that I meet that even if your pregnancy is high risk, many times that means we're monitoring for things, but that does not mean they'll necessarily happen. And most moms and babies, regardless of the risk, are still going to do well. It just might take a few extra visits or a few extra medications to get there.